Hi, I'm Julie Blacker, and I'm clinical director and a sales representative at Current Medical Technologies. And I am so excited to be here today with Pany, an amazing pelvic floor physical therapist. So, Pany, can you tell us a little bit about yourself, please?
Sure, and you are a pelvic floor specialist too. So, and
Yes,
I
I
know you
am.
also, yes. So, yes, I'm Pany Nazari. I'm a doctorate in physical therapy, and I've been a physical therapist for almost 27 years. I have done orthopedic physical therapy, but as life has it, I ended up being a women's health specialist, men's pelvic rehab specialist. I am a clinical instructor for Herman and Wallace Rehab Institute, teaching other wonderful clinicians in the world how to be a pelvic floor therapist. And I also have a certification with them through PRPC, their pelvic rehab specialist certification, and biofeedback specialty.
So, Pany was instrumental in designing this amazing product that is used for having bowel movements with prolapse. And I am really excited to have Pany explain all of this to you. So first, I'm going to bring up a video or a picture of anatomy.
Good idea. Yeah, let's go from there.
Yeah.
In that picture on top, we're looking at the normal anatomy. Most people don't have normal, but that's okay. We go with it. So in the front, we have the abdominal wall and the pubic symphysis. In the back, we see the spine and the sacrum, and at the end of it, the coccyx or the tailbone. The pelvic floor muscles connect the tailbone to the pubic symphysis in the one-dimensional way that we're looking at it, creating a hammock. I will show you a 3D model to see how that hammock works. And then if you look at the pelvic organs, we have the bladder and the urethra in the front, the uterus and the vaginal canal, and then the colon for top and the into rectum and the anal sphincter at the bottom. So the pelvic floor muscles kind of hug and hold everything up. They support these organs up, keep them where they belong when we don't have any issues. With the picture below, if you look down, the same anatomy. However, there is a little deviation, maybe more than a little, but with the rectum collapsing forward into the space that was formerly known as vaginal wall. So the collapsing is usually due to long-term straining or constipation or pressure changes that just really compromise this tissue. So instead of the tissue being this nice tunnel that things can come through, now you have a pocketing, if you will. So that pocketing is usually by the eye of the experts and clinicians who have expertise, can be assessed and observed, but a lot of women already know it, that there's something that wasn't there before. But the other thing that is important to see is that how that collapse or the pocketing is dropping itself downward as well into the pelvic floor area. So that pressure downward is palpated or felt by a lot of women.
Yeah. So with this Rectocele, as you just explained, with the anatomy, and I'm going to stop sharing that picture now. How does a woman have a successful bowel movement with the Rectocele?
Yeah, so great question. So Rectocele is that collapsing, that pocketing, and other organs can come down to. Women hear these words all the time. And it becomes very difficult. And my biggest pet peeve is that a lot of these women get misdiagnosed as having constipation, but they are not constipated. Like if you ask them questions, they're having a bowel movement every day, their feces looks nice and happy, look, a banana comes out, and it's not lumpy that the constipation would be. So these women with their intuition and their brilliant brains, they start doing this technique that we refer to and we recommend to women to do to create a better system to defecate, called the splinting. Splinting is basically trying to apply some kind of pressure to the pelvic, through the vaginal canal backwards to create a wall, or upward through the perineum. Most women have a tendency to use their fingers and other devices sometimes to go into the vaginal canal and create a tunnel again that things can slide through. So the term splinting has been used, but as you can imagine, a lot of women are very reluctant to do that. It's not hygienic, it's gross, it's, it's feces, and they just, they have to really modify their lifestyles to accommodate these things.
I mean, yes, to everything, yes.
Yeah.
And so you had this concept to help women, and you worked to create this amazing splinting tool, your splinting device, if you will.
Right.
What was the inspiration?
Well, I had issues myself. I think in retrospect, what I think about it, throughout college, I had constipation and dealt with a lot of difficulty with bowel movements, not having the symptoms of prolapse. But after giving birth to my beautiful children who, brought love and other things to my life, one was a gift of seals, the Rectocele being one of them. And that was my way of being able to have a bowel movement. And because, as you know, having young kids, who has time to sit there for 10 minutes to have a bowel movement or just try to figure out how to have a bowel movement, right? So me, like a lot of patients that I see now, would suppress the urge to have a bowel movement, or just it was becoming problematic until my intuition, and then by learning, I learned about the self-splinting technique. Also, for a period of time, my dad was in a rehab center, and being a physical therapist, you start talking to other rehab professionals there because you go there all the time. And I heard that a lot of women in rehab centers, or elderly women that were there, they were using all sorts of crazy devices to be able to have a bowel movement, like shoehorns or other things. So I was like, holy cow, we can't have this. Like this, can you imagine an old lady with fragile tissue sticking a shoehorn into their vaginal canal to be able to have a bowel movement? And I'm thinking, oh my God, the tissue trauma, the tearing, the infection, and all of that, it was just making me we gotta do something about this. So so that was the inspiration, and I know that there were other thoughts too. So it was just how to make it work for a age range of women in different stages of their lives. That was inspiring for me.
It's amazing. And so I know it's been a labor of love, and you've worked on this for a really long time.
Yeah.
But it's on its way. And can you tell us about the design?
Oh,
because I know every part of this device has.
So I think this thing is going to go into my grave with me because it's one of my favorites. But no, so this is Release, and this Release has two heads, if you will, and a very long handle. The handle, we played with it a lot because we wanted it to be longer for women who may have extra abdominal, girth and a little maybe obesity, but and reaching down into the pelvic area was difficult. Or even some women who may have really bad hips or knees and they can lean forward to do the self splinting. So the longer handle is what was one of my goals, to how can we make it still very, discreet, but feasible for everything. Then the two handles, as you can see, they has a longer end here and a shoulder and shorter end on this side. The longer head is what is designed to go through the vaginal canal. The width of it, I wanted it to be not too wide because it can be disturbing to women who have thinner tissue, like vaginal thinning because of age hormonal changes. So the width is not so wide, and it's really soft, even though it's firm, but the tissue is, what it's made out of is very soft. And then if you can appreciate the little angulation here on the top here, is to, when this is inserted, our goal was to not irritate that back wall of the vaginal canal. So basically, as the pressure is applied through, let me do a quick presentation here. So this is a little design here to show you there's the vaginal canal, there is the anus, there is the pubic bone in the front. So if you're sitting on the toilet and you insert and you press backward, this angle here doesn't let the pressure to be directly at that opening of the vagina, which can be really tender and hypersensitive in some women. So that's the design, that was the planning behind that. And then for the other side is what would be used externally. As that we showed in the anatomy and the picture of the rectocele, as it drops down, we want this part to be applying externally to lift the perineum up so the anus can open more effectively. So in that case, if there is the pubic bone, and if I can just give you a little saddle view here, you're using the wall between the vaginal opening and the anus and applying the shorter handle against this area, pushing it upward to kind of create this wall, an artificial wall, so things are supported and then, you know, the anus can open more effectively.
It's really mind-blowing, and it's just so seemingly simple.
But you know, the beauty of it is that as compared to other devices is that the fact that we do have the accommodation both for internal use and external use, and the longer handle for any kind of, you know, disadvantages that it may be for the tongue.
Yeah, no, exactly. So with cleaning and storage, what would that look like?
Oh, sure. So again, one other benefit of this having short, you know, two ends, you know what goes in and what goes out. So hopefully there's no cross contamination.
Yes.
Despite that, though, what we recommend is to using warm water with like a very, you know, regular soap, hand soap, or, you know, body wash that people use, and just washing through the whole length of it. That 20-second recommended that we wash our hands to get most germs off. To getting, and I mean, there is no creases. This is non-permeable. The material is such that it doesn't. Things can't go through, so it really washes on the surface perfectly. And then kind of pad drying it, and the box, you will have a little storage packet that it will come, that is, you can just store it there, and just making sure that, you know, there's no cross contamination, you know, washing this side first and then letting it dry. Again, because of my, you know, my big thing as a clinician is like, we are wellness professionals. We are people who are teaching people hopefully not to have problems, right? Thankfully, you know, a lot of women can catch themselves early before they have prolapse. So that was one other inspiration, thinking how many women ended up having prolapse because of the life changes that happens to them. They get constipated and they have to strain, and the guts is not moving and all of that. And they didn't have a prolapse, but because of all of it, now they ended up having a prolapse problem. So if we can teach women that they can use it if they're going through a bout of constipation, or if they have IBS, GI issues, any other issues that sends them through chronic constipation, maybe use it even if you don't have a prolapse, so you won't end up having a prolapse. And then, you know, and just because you're giving that wall, not allowing it to get stretched. I mean, the way I want people to think of this is that our ligaments, our connective tissue that is holding our pelvic organs together is like a rubber band. You keep pulling, it's eventually not going to go to its normal elasticity. Yeah. So by creating this pressure, hopefully you don't let it keep getting stretched. So that will be that population that don't have prolapse or issues. And then obviously, you know, dear to my heart are women who are going to premenopausal, postmenopausal with a lot of thinning of their tissue, and that support gets even more compromised. And shoehorns are not allowed, so we want to use a device. Yeah. So that's.
Oh, I mean, Pany, thank you, because I feel like you are just changing so many people's lives, you know. Like people who have the smearing after they have a bowel movement or what, and they don't want to leave their houses and they don't want to go do the activities that they normally would do, or I mean.
No, and thank you for bringing that up. Yes, you know, that's a very good point. A lot of women may not have the splinting part and not knowing that they're having problems because they're splinting. But they get up and walk around, and then after that they see that they have a little bit of a smearing of the fecal material, and that's because, you know, feces was trapped in that little pocket, and they get up and walk around. And I've had multiple women that with the splinting, but some of my patients used the prototype, and they said their post bowel movement smearing was completely abolished. and they had gone thousands of dollars of testing and seeing if what's wrong with them. And it's just a mechanical problem. It's not a, it's not a system problem. It's just a mechanical problem, how things have been stretched. So yeah, you're absolutely right. And just not having to sit on the toilet for periods of time, which then creates its own problems, right? Yeah. So, or push back having a bowel movement because you don't have 15 minutes to sit there, which creates all the problems. So hopefully, I mean, if it's my little tiny bit of a contribution to the society to make their lives better, I'll die a happier person. So.
I don't know. I think it may seem small, but I think it is a giant. Like, we are walking in giant shoes, because, I mean, you're truly going to change a person's life. Like, I know with a lot of my patients, and I'm sure yours too, urinary incontinence is bad enough, but when there's problems with their bowels, forget it. I mean, it seems like the world is over.
So much. Definitely, it's something that, you're right. I think women, unfortunately, have been trying to think a little urine leakage is okay, which is not. But fecal myself is just like, no, this is a no tolerance zone, for a lot of women.
I know. So, well, Pany, thank you so much. It's so exciting, and I literally can't wait for everybody to try it. And I mean, I think it's one of those things, like, once you have it, you can't unhave it. So
it's gonna be on your stocking for everyone. I really want to give kudos to people at CMT, because we had this conversation. We're like, can we get what stuff is out there in Europe, bringing whatever. But then Earl and I, the owner, we talked about it. We're like, we really need to have this very, very available in the United States of America. Like, think about the population. 1 out of every 3 American women suffers from pelvic-related issues. And I'm really grateful, because they did all the running around and creating and talking to people who, I don't know anything about that, the legalities and stuff. So I'm grateful that we have this collaboration to bring this to market, and hopefully it will benefit people.
I think so too. And thank you, and we can't wait for the next thing to come from you.
Great, thank you so much.
Have a good one.
Bye.